Back pain is one of the most common reasons people come to see me. One of the treatments we do to help with that is epidural steroid injections. I'm Dr. Ammon Hills. I'm a pain management physician, and I help treat people by relieving their pain and improving their function. Back pain is one of the most common reasons people come to see me. A lot of times they have back pain with excruciating pain going down their legs. One of the common treatments we do to help with that is epidural steroid injections. Epidurals that we give for chronic pain are different than what we would do for like pregnancy, for example. So this is a very precise injection. We use x-rays to guide our needle to a space just outside of the spinal canal called the epidural space. So let me tell you about a patient I had. This is a gentleman who is in his mid-40s who has to do a lot of lifting for his work. And he was lifting some heavy boxes, probably not the best posture, and ended up having this severe pain in his back shooting down his right leg. So this is a really common story. You hear this one all the time. Someone lifting something heavy, feeling a pop or some severe pain, and then that pain going all the way down the leg. So this patient, before he came to see me, he's tried medications and physical therapy, but both didn't really help take away the pain. Since none of these treatments were giving him the relief that he was looking for, we ended up getting an MRI of his low back, and that confirmed our suspicion that there was a disc that was irritating one of the nerve roots that goes down his leg, causing severe pain. At this point, this was really affecting his life. He couldn't work, wasn't doing the things he wanted to do at home. He was feeling depressed, moody, frustrated, as you can imagine. So at this point, we decided to proceed with the epidural steroid injection. So first thing, as we get the patient into the room, we're gonna position them onto the table to get them nice and comfortable. So we're gonna get them all hooked up so we can monitor their vital signs and so we can be safe. After the patient's positioned on the table, time for me to get my gloves on and to start drawing up my medications. We use lidocaine to help numb up the skin, decrease pain of the actual needle. We also use a contrast dye that shows up on the x-ray, which is kind of like a second safety check so that we can verify we're in the right position and not in a blood vessel. The last medication we drop is a steroid, which is the medication that helps to take away the pain and inflammation around the nerve. So now that we got our tray all set and we got our patient positioned on the table, time to clean their skin off with a special soap called chlorhexidine soap, just to help decrease the risk of any infection. Then we put down a little sterile drape on top of the area that we're going to be working at, just to help keep the area clean and sterile. At this point, we're going to do another safety check or pause just to verify that we have the correct patient, we're doing the right procedure, and that we review the allergies and vital signs, make sure we're good to go. We're gonna bring the x-ray machine in and align it over the spine, over our target area. And so this is gonna help us to really see where we're going to go to help give us that precise injection where we use the x-rays to guide our needle exactly where it needs to be. As you can see, this is a finesse procedure where we're using tiny micro movements to really guide that needle slowly towards the epidural space. And as I'm making these small movements, we're also taking many pictures as we continue to advance the needle. Once the needle is in position, we're gonna inject a little bit of that contrast dye to make sure we're in the right spot, that it has a good spread, that we're not in any blood vessel, and that we're ready to give the steroid. After we've confirmed our correct needle position with the x-rays and with the contrast dye, that's when we'll start to slowly inject the steroid injection. We inject this slowly to make sure that we're not causing more pressure and pain up against that irritated nerve root. Before the injection, this patient, his average pain on a scale of 0 to 10, where 10 is the most pain you could be in and 0 is no pain at all, he was ranking his pain at an 8. After our injection, we always take a post-injection pain score. He said his pain was down to a 2 out of 10 in pain intensity. And so depending on his response, we'll determine how we treat him in the future. Depending how much pain relief he gets and for how long, we'll determine what the next steps are. For example, if his pain is decreased at the time we follow up, but not quite where he wants to be, it may be necessary to repeat this injection one more time to get longer lasting pain relief. However, some people may do well with just the one injection. So with this patient, at his follow-up, he was doing pretty good with just that one injection, so we're not planning on repeating it as of now. So he continues to have good pain relief with just continuing his home exercise program and with nutritional changes. A common question is, how many of these injections can we do a year? We wouldn't want to do more than probably 4 of these a year. If you or anyone you know is suffering from low back pain, shooting pains down the leg, the sciatica, and just not improving, feel free to comment below or feel free to give me a call for a more individualized consultation. For more medical stories, go ahead and click that video right there. And I'll see you guys next week.